Hello, my name is Beth Pratt. I am a PhD student and GNS Liaison at Florida Atlantic University, Lynn College of Nursing in Boca Raton, Florida. And I'm here today with Dr. Rose Sherman to interview her for the GNSA Liaison project entitled Great Minds in Nursing, Insights from Nursing's Thought Leaders. Welcome, Dr. Sherman.
Well, thank you for having me today, Beth. My name is Rose Sherman, and I'm a professor in the College of Nursing, the Lynn College of Nursing, and director of the Nursing Leadership Institute.
Great. Can you describe your nursing work and career and how you got into your current research?
Okay. Well, you know, my career is pretty non-traditional, Beth. I actually began my nursing career with 25 years in the Department of Veterans Affairs, where I had leadership in 5 medical centers. And it was really through my work at the VA that I became interested in leadership development, which is my area of research interest. So my current areas of interest include leadership development, succession planning, and basically the challenges and issues facing nurse leaders today.
Okay, very good. So how would you describe your leadership in nursing in the healthcare field and any specific issues or gaps in the science and what your significance and impact is in the nursing field?
Well, having impact is extremely important to me, and I believe that if you are going to have a research trajectory, it's really important that you choose one where you can have impact. And so what I look for as I begin to do my research work is, where are the gaps in the literature, what are the issues and challenges that leaders are having out there in the community, and what difference will it really make in practice? So some of the areas that I've studied over the years include the competency development of nurse managers. I've looked at charge nurses and how effective they lead at the front lines of leadership. Recently, I did a really interesting study on perioperative nurse leaders nationwide, looking specifically at their succession planning issues. So I've really looked at all the different levels of leadership. I try to look at where there are gaps. I talk to leaders all the time about what their issues and challenges are, and that's kind of what drives my science. I've been really fortunate over the years that I have received $2.5 million in funding, both in research project funding but also training grant funding to help support my work.
Amazing. Great. What do you think will be better in nursing and healthcare because of your science and leadership? Or how do you expect it to impact any local, state, and national policies?
Well, I think that's really a really important question to ask, because as I mentioned, if your work doesn't have impact, why do it? Mm-hmm. So I always look at not only the what of the issue I'm looking at, I look at the so what, and then the what now? What happens after I do the research? What kind of an impact will it make on practice? A good example is the work that I'm doing right now that I've just been funded for the Blue Cross Blue Shield Foundation to look at long-term care nurse leaders in the state of Florida. And what we'll be doing is we're going to look at their issues, we're going to look at their challenges, and we're going to consider their leadership development needs. Now, this is very, very important. When you think about it, we have 10,000 baby boomers turning 65 every single day, 3 million a year, and 69% of those baby boomers are going to need long-term care. And yet we know that there are many, many leadership challenges in long-term care. It has one of the highest turnover rates in nursing today, more than 60%. And so how do you get quality? How do you get quality in an area where you have that much turnover, where you have that many challenges? So those are some of the things that we'll be looking at that hopefully are going to really inform workforce policy, but also may inform health policy as well.
Okay, great. All right. How do you think then it will impact healthcare outcomes?
Well, I think when you think about leadership and you think about leadership research, the impact on health outcomes is a little more indirect because leaders work through their staff to deliver outcomes. And yet that leadership really, really matters, because it's really leaders that set the culture that allow staff to do the best work that they can possibly do to really affect those outcomes. And so culture really, really matters. And there's an old saying that says that culture will eat strategy for lunch every time. And you can put some of the best initiatives in place, but if you don't have strong leadership to drive those initiatives, they're probably not going to happen. And we have some research out there that even evidence-based nursing practice, one of the reasons why it's been so slowly adopted in nursing today is because the leaders aren't behind it, and that is so, so important.
It is important. Is there any other information you would like to provide regarding your program of research?
Well, I think that my program of research, one of the things that I am really concerned about when I do research is the work really going to be translational? And that's important, because I consider myself to be a translational researcher. So how you disseminate your work becomes very, very important when you do research. So I not only look at the traditional research journals, I also look at the other publications that my target audience is probably reading. Some may not even be peer-reviewed. I also look at conferences. So when I do research, I'm never afraid to stand up in front of a group of leaders and say, does this resonate with you? Did I miss anything? Getting the word out is really important to me, and I think it should be to all researchers.
Yes.
But it's dissemination. I think about dissemination with every project. I think about I always try to include nurse leaders as co-partners, co-investigators on my research, and even co-publishers on the articles that I write.
Perfect. Advice do you have for the next generation of nursing leaders?
Well, I think about the advice that Steve Jobs used to give to his staff at Apple, and he actually took it from Wayne Gretzky, who is a very famous hockey player. And Wayne Gretzky used to say that you need to skate to where the puck is going and not where it's been. And I think that's so important for our up-and-coming scholars to think about this, because some of the things that historically have really mattered, especially in our academic environments, may not be as important in the future. I think about things like NIH funding, NINR funding. That is going to be much more competitive. It's going to be much more limited. And yet, it's kind of been the gold standard in our work. But I think we need to look beyond it. We need to look at other places where we can get money to fund our work. And Family Foundations, as an example, is a really good place for future scholars to look. Another area that I think that our up-and-coming scholars need to think about is where and how they disseminate their work. I think that historically we've looked at disseminating our work in research journals that have high impact factors. I think in the future our open access journals are going to become much more important. And we may see some major changes to the peer review process, as an example. So publishing is something that I think that we need to really consider as well. I think another piece of advice that I would give rising scholars is to make sure that you really choose a research trajectory that you can be passionate about. I see too often that people kind of get driven into areas that are really other people's work and not their passion. And, you know, this is something that you hope to do for a very long period of time. So you want to feel passionate about it. You want to feel good. You want to feel like you can make impact. Because at the end of the day, if you can choose something as a scholar that you're passionate about, if you can choose a work that will have impact on nursing and healthcare, and if you can choose work that will really is something that you can be the best, the absolute best at doing this work, that's where you're really going to make a difference with your research.
Thank you so much for your inspirational advice. I really appreciate your time.
It's been my pleasure, Beth.